Hi everybody, it's Catherine here, and today is February 22nd, 2023, and today is my day 30 healing video. Can't believe how fast it's gone, truly. When you're in the moment, especially during the treatment, it doesn't feel like you're going that fast, but boy, I'll tell you what, it has gone fast, and I would do it again in a heartbeat. I absolutely would do it again in a heartbeat. So for any of you that are just watching these videos as maybe, trying to sum up whether or not you want to take the plunge and do this topical chemotherapy treatment, if your doctor has recommended it and you're just trying to figure out how to manage the time frame that you will need to do this treatment, I mean, there are things to consider, and I will do another video that kind of outlines what I think are the considerations that you should, have as far as planning your treatment. Now, of course, if he's telling you, he or she is telling you that it's something that you need to do immediately, obviously you're going to do it immediately, and you can use videos like mine and other people to kind of gauge your skin type, your skin tone, and see how you can get through this treatment. But I will tell you, I would do it again in a heartbeat. So I'm not going to make this a long video today, but I do want to give you a close-up of my skin as I have in the past, and just kind of tell you what I'll be doing in the not too far off future as far as videos regarding 5FU or Efudex. So let's take a look. So I've just taken my shower. It's been about 15 minutes, so I do have just a little slight redness due to the shower, but this was that area that I had spot treated and was kind of patchy and a little bit sandpapery, and it is now, I probably shouldn't rub it while I'm doing these videos. It is now a little more skin-like. This patchy area right here is still a little bit chapped, but not feeling nearly as, I guess the only term that I would use is chapped and sandpapery, but it is improving. And then going up into here, it is shrinking. The chapped area, the sandpapery look, is shrinking back. This one's a slow one though, so I don't know. I have a doctor's appointment on March 8th, and if it's not gone by then, he and I will talk about that. And this little spot under my nose is slowly diminishing. It's not peeling or chapping or anything like that. It's just a little bit red. And then I'm going to give you a close-up of my nose. And one thing I do want to tell you, this is not going to take care of your blackheads. This is not going to take care of your melasma. This will definitely take care of some of those raised little bumps and things that you have on your skin and give you a little bit more of a smoother texture. Its sole purpose really is to kind of heat seek and kill out pre-cancers. It's not supposed to be like a resurfacing chemical peel or anything like that. Now here's that darn wrinkle. So I was hoping that that sucker would go away, and nope, it's here. So I can tell you it does not get rid of deep wrinkles. This was a spot that I had treated, and it's starting to fade out. And this was the one that I was really concerned about right here, and I'm very happy with the way it's looking. So we'll just, keep our fingers crossed that, it's just a healing thing that it's going through. But, under my eyes right here, this was nasty, and this was very tight and scabby, and I'm really happy with the way that's healing. And then I'll give you a look at this side of my face. Now you have to remember, I have extensive sun damage that goes back to childhood, and I'm 63 years old, and I'm talking to childhood, 2, 3, 4, 5 years old. I mean, I have been in the sun my entire life, and trust me when I tell you, I am not bragging about it. If somebody could have hit me with a stupid stick way back then, I would have appreciated it. But here's that one spot. This actually peeled this morning, so that's healing very nicely. And then, you know, my eyebrows were a huge concern. And while they don't look perfect, I'm pretty happy with them. And then see the side of my nose. And again, this was my Mohs surgery right here. So this did not receive any treatment right through here. And that is that. So these spots that I had up in my forehead hairline right here, those just disappeared into nothingness. And I don't know if you can see where there was that weird track of spots and scabs and whatnot, but it's interesting how even though the spots have kind of eroded, they've scabbed and they've kind of fallen back into the background of my skin. And then you can see up here, I still have some darker spots, and those were being treated. So I am definitely going to have questions to ask him, and I will most certainly do a video on March 8th and tell you what he and I discussed and what additional courses of treatment I'll have. Oh, and I had forgot that spot right there. And this one is very scabbed and peeling. So I'm really happy that I continue to spot treat that afterwards. I had asked my former dermatologist multiple times, could you freeze that area? Could you freeze that area? Could you freeze that area? And no, you're fine. No, you're fine. Well, you know, maybe it was fine. I don't know, but it did react, and it's not going to react if you don't have something brewing under there. So I'm really happy that I followed my instincts and I went ahead and I continued to spot treat that. So, anyhow, if you are currently going through this treatment and you're just watching these videos to kind of gauge your progress, which is exactly what I did. So, you know, we're human. We want to know. I mean, we've got Dr. Google and we've got YouTube. And as much as our doctors hate it, oh well, you know, this is what we do to kind of make sure that we're on the right track, that we're, you know, seeing the results that we think we're supposed to be seeing, and just gauging our own progress, and, you know, trying to save ourselves some phone calls to the doctors in between too, as to whether or not, you know, treatment's working or not. So I hope that these videos have been helpful for you. And for any of you out there that are currently going through the treatment, stay the course. You know, follow the guidelines. If you're not having the breakout or the flare-up, I'm not going to call it a breakout, the flare-up or the blooming that you think you should have had, based on other people's videos that you've seen that, you know, maybe blew up on day 2 or day 3 or whatnot, keep using it, keep using it, keep using it. If you get to day 14 and you feel like your reaction hasn't been as active as you would think that it was, talk to your doctor. See if maybe you should go to day 21. That's what I did, and I'm really, really glad that I did. And I ended up spot treating a couple of areas after that, just because they hadn't quite come to the full stage of, you know, scabbing. But you don't want to end up quitting this treatment too early either, because most doctors make their follow-up appointments after you've healed. So, you know, I would encourage you to most definitely, if you're not having what you think is a complete reaction, consider going to the 21 days, but do it with your doctor's authorization, and possibly save yourself another, you know, 5-fluorouracil treatment later on. In my case, I will voluntarily do this treatment again, just because I know that there is other stuff brewing under my skin. I just know it. I've had way too many years of exposures to think that this was a one and done type thing. But for you, it could very well be a one and done thing. And it's certainly a good treatment to head off any future skin cancers that may be brewing underneath there that really haven't gone too far. So, stay the course. If you're still thinking about doing the treatment, talk to your doctor. I know I say that in every single video, and I do that mostly because I don't expect people to watch, this many videos to come up with whether or not they want to go through a treatment. And I believe there are some that will watch every single one. I'm one of those people. But for you, those of you that pop in and pop out, you need to really think about this as a preventative for future skin cancer activity. You may already have some that are far too gone, and you will have to have some sort of intervention with those, skin cancers, whatever they may be. But maybe this will save you from many other types of treatments, the freezing, the scrapes, the biopsies, the Mohs surgeries, all of that. So anyhow, so my plan is right now, I'm going to stop doing recovery videos. I'll see you again on March 8th, and in between, I may post a video or two about a couple of things that I think would be beneficial for people that are thinking about this treatment. And then afterwards, I will do some videos on my different skin cancers and specifically my Mohs surgery, because if there's anything I would love to be able to show you is why you need to protect yourself from the sun, and you absolutely need to make sure that you are staying up on your skin checks and the possibility of preventing yourself from having a Mohs surgery, because let me tell you, they're not fun. So that being said, you guys have a great day. Thank you for following me. Please like, subscribe, comment, share, please. Anybody that you can put this in front of that, whether it's your teenager or your grandpa, just do it. I mean, we're here to help each other. So thank you so much, and I'll see you soon on March 8th. Bye.